Hello, everyone, and welcome back to Mic Check
2.
My name is Rachel.
And I'm Sean.
And today we have a lovely, lovely co-host. We are so excited that you are able to join us. Dr. McKinney, we'll allow you to introduce yourself.
Hi, I'm Dr. McKinney. I've been with St. Hope as a podiatrist since 2014.
Ooh. She's 10.
That's some seasoning on that. Yeah, I was like, okay, I know it was that long. Yeah. So what originally brought you to St. Hope?
I was looking for an opportunity, and I happened to hear about some different opportunities from another provider who wasn't at St. Hope, but she introduced me to, at that time, it was Dr. Lewis, a long time ago. Okay. And that's how I just went ahead and kind of had my interview. And at that time, it was a little different than it is now. Mm-hmm. We were still in the earlier stages, probably, of some of the programs and things at St. Hope. And next thing you know, I started out at Conroe, and the rest is history.
And now she goes to all 4 4 of our 5 locations.
Yeah.
6. We have 6
locations.
6? Remember?
Oh.
Yeah.
Northwest. Sorry, Northwest. I'm sorry. My bad.
Okay, so what got you interested in being a podiatrist? For those who don't know, a podiatrist is the foot doctor, by the way. So.
Right. So we're about to talk about the good, the bad, and the smelly of the feet. So
we want to hear it all.
We want to hear it all from you, Dr. McKinney. So we're about to dive right in.
Yeah. Oh, yeah. Let's dive in. Okay. So what made you want to specialize in foot care?
So first of all, I wanted to be a doctor since I was 12.
Oh. Yeah.
And when early on, I was just kind of looking at different specialties. It wasn't until I went to Prairie View and I was in a seminar class, and a podiatrist, it was one of the podiatry schools came. Mm-hmm. And that's when I first learned about podiatry as a specialty. And I thought it was really interesting, mainly because diabetes. And podiatrists do a lot of work with diabetics and trying to save feet, save limbs, and save lives. And since diabetes runs in my family, I went ahead and just started to do my own research. And next thing you know, when I finished at Prairie View, I went ahead and applied to podiatry school. And again, the rest is history. And it's been well over 20 years of practice. Wow. So, yeah.
So wait, how long does podiatry school, if I'm saying it right, how long does that take?
So it takes 4 years. So we are doctors of the foot and ankle. Mm-hmm. And we normally go through, get our 4-year degree. Mm-hmm. And from there, you go on to another 4 or 5 years of podiatry school. And then from there, you do residencies. At the time, I came out quite a while ago. Now it's totally changed. So now it's like up to a 3-year residency. So, yeah. I did a 1 year.
Oh, okay. You got 1 year. 3 years? I'm like,
3 years of residency.
They want your firstborn?
Yeah, they do.
Social,
now that they definitely do.
Oh, okay. So what advice would you give to somebody who's interested in becoming a podiatrist?
Mainly to go and do their own research first, and then talk to other podiatrists and or students, residents who are already practicing or learning how to get into the practice of podiatry. That's how I did it, and I think that's for anyone going in any profession. You want to find somebody who's in it and then start to talk to them and see what knowledge they can impart upon you.
So you had just kind of felt it and you were like, I think this will be a good choice for me just because.
I did. I had my thoughts early on. I went from being a pediatrician or, that was really...
you be a pediatrician though.
Really?
Yeah.
Yes.
I can see that.
Well, y'all are really...
So she's like, career change.
I don't know if she can't real, but, I had different specialties in mind. And then it just... Once I learned about podiatry when I was in college, that's when I just opened up and said, okay. And I started doing my own research. And then just in talking to many other people, that's when I actually met podiatrists and met people in podiatry school and just kind of evolved from there.
Okay.
So is there a common myth that you had to like feet to work with feet? Do you like feet? Like when you get home and somebody touches you with their feet, or you're like,
no. It's like this slow cream.
You're like, I've seen enough feet today. Thank you.
It's not like that. It's almost like especially imagine a dentist, you know, and it's like, well, do they like teeth?
Yeah.
Or, you know, it's not that. It's just, it's a specialty. Yes, it's a job, a career that I've chosen, so I enjoy what I do in that profession. But when I'm out of my white coat and my scrubs, I am not looking at everybody's feet. So it's just not like that.
See, I think I would be like, if people had sandals on, I'd be like, I know what that is. I can give you my card.
That's a bunion.
Yeah, that's
Now that comes to mind.
Yeah, like,
but however, but you know,
let people have their own feet. Okay.
exactly. You just nice about, you know, it's, you know, you can't just walk up to somebody, oh, you need help.
Yeah.
You know, you can't do that. So I don't, you know, I'm just like, okay.
Have you seen recently I'm sorry, I know you're about to say have you seen something recently where it was on the Shade Room? The girl had got her toes redone. Have you seen that? Like reconstruction surgery on like her toe. Like, yeah,
Her
they made them
toes.
pretty feet.
Really?
Yeah, it's a thing. I'm gonna have to find it later and I'll show you.
Please do.
Yeah,
Oh,
like
my.
Look, we're both looking like what?
Because they was like crisscross jumping, but they got them, straight and like narrow
Toe
them down.
reconstruction surgery.
Yeah, just food for thought. Yeah.
Okay. I mean, yeah, if they're having pain is the number one indication for surgery. So,
Okay.
you know, but I'm interested to see what, so show me.
Yeah.
real
This
soon.
was more like a cosmetic, I think. Yeah, I'm
okay.
not sure it was pain,
Okay.
but
Okay.
She wanted pretty feet.
yeah, she
okay.
wanted pretty
Okay.
feet.
Gotcha.
Yeah, for the Instagram, for the gram.
For the gram.
So, let me ask you. So, a lot of our patients get recommended to see podiatry at St. Hope. A lot of our patients have no clue why they're seeing podiatry. And I know that is your job to educate them. So, for our listeners out there, why is it important to stay up to date on proper foot care?
So everyone needs to take a good look at their feet and make sure everything is okay. But it's primarily patients who have problems with their blood circulation. They may have diabetes. They may have HIV. It could be anything. But more so if they have nerve problems. They could have, you know, anything, multiple sclerosis, any type of comorbidity, it doesn't matter. But your feet are your foundation. So if something's wrong with them, normally if you have foot pain, then something, you know, it's
Something
like
needs to be
when,
checked.
like when your feet hurt, everything hurts.
Oh, yeah,
But
your back hurts.
you know, I mean, anything can hurt. So I really just tell patients, fortunately we have it set up at St. Hope so that I'm able to really introduce patients to my specialty and share with them. And often by the time I'm done, I do an exam, I'm able to point things out and educate them on their feet. And that's something that many patients haven't had before. So some come to me and they don't have a problem, don't think they have a problem, or think it's real common. And then some, it just kind of goes on from there. And I'm able to develop a treatment plan and really help
And you
them.
even have faithfuls, because at some point, I know there's a couple patients even at Sugar Land when you come, they didn't like podiatry service. They're like, I don't want to see the foot doctor. But then they realize what you're doing, and then you give them a treatment plan, and they want to see you literally religiously, like once a month, twice a month.
That's exactly so. It's just an honor to be able to help people with something that when it comes to the feet, they sometimes, you know, they're ostracized. It's the part of the body that we look for our cute shoes, but when it comes to anything else, you know, oh, my feet, yeah, whatever, you know. But it's more to it than that, and it really does help with quality of life. So I get to help with that. That's exciting.
So how often would you recommend somebody seeing a podiatrist?
So it depends.
Okay, on their
Okay.
treatment plan.
So let's say it's someone who, if they have diabetes or, you know, they smoke, then I would recommend they probably see them every 3 months or so.
So smoking is a...
can affect your feet.
Huh.
So anyone, smoking affects the circulation. So people can end up with poor circulation. They just don't know it. So
Is that why their feet always fall asleep? Does that correlate, or that's just kind of?
Well, that's more so with the nerves, but
Nerves.
it just depends. They could have an underlying nerve problem as well. So, but it's not like the regular young, healthy person with no medical problems. They don't necessarily have to come to see the podiatrist. Maybe it's, you know, if there's usually pain is a good indication if someone needs to come in. So it's hard to say everyone should go once a year. Like we go get our eyes checked once a year, or, you know, go to the dentist every 6 months.
Right.
But
So it's more like a pain indication. That's kind of interesting because most places are like, you should just go regular for checkup. But
I know
like
we
this
become
case,
good friends over time.
your foot pain.
She knows I've had my own set of foot pains, and we've had to do a couple of things, but so that's why she laughing. She knows.
So would you say pain is the most common thing you treat as a podiatrist, or would you?
Pain has a lot to do with it, yes. And then it goes deeper. It goes into the lack of pain. So that's when you have a patient that you have to really educate, and they don't know that they can't feel certain things. So I'm doing nerve testing and there's various types of different tests that we do. Just right there in the clinic, just to let them know, I was doing these different things and you didn't feel it.
Right. I just wiggled my toes too. I was like, "Can I feel my toes?"
I know, right?
When she said that, I wiggled my toes. I was like, "Do I feel my toes?" I never even checked in.
Some people don't they can't feel their toes at all. So,
what about like heel problem? Do you get a lot of heel problem? No,
I do.
That's my
it's
my weakness is heel problems.
Okay, lots of heel pains. Yes.
So I was gonna ask, like, is it? Can you kind of explain what like a diabetic exam would look like? Because I know you mentioned like diabetes is probably like one reason you'll come in, or a condition that you could have that could lead to like foot pain or different things. So like, is the exam different, or are you just like tickling their toes and that's all they have to expect? Like, what happens?
There's no tickling.
Okay.
All right, we are dispelling a myth.
Yeah.
When the podiatrist comes in, she does not tickle your feet.
There's
there's like a little tickle and it'd be like, "You're good. All right, see you in 3 months."
No, it's so much more than that.
Okay. I actually really like feet. Fun fact. I don't like feet touching me, but like I like watching the feet videos when they're like getting their feet.
Really?
Yeah.
Oh, okay. Look, him and Dr. McKinney on the same page with that. We're like, oh, okay.
Y'all don't like when they get their toes done?
Girl.
No.
No. You're alone. You're alone in that ocean.
Okay, I'm gonna talk to my therapist next week on Mic Check. Let's dive into why Rachel likes these videos. Okay. But so explain what an exam entails then, because I really thought you were just like, let me.
Because I know, like, even with our diabetic patients, I know that is something they highly recommend. So like, if people see like Dr. Roberts and she's doing like the care planning, that's one of like the first things. Please make sure you set up with Dr. McKinney for podiatry. So what do you look for something in particular with diabetic foot exams, like something different than the other regular tests?
Yeah, so with diabetics, I'm looking for, do they have any type of loss of protective sensation? So we do a general foot exam for all of our patients, but the diabetics, we dig a little deeper and want to see, we use something called a monofilament. And it's a piece of plastic, and I'm touching the toes and the feet in different places. I just want to see, can they feel that? Often diabetics lose sensation at the tips of the toes and sometimes the ball of the foot area. And when that happens, they can't feel, like they were walking and they stub their toe or they drop something on their foot. They just won't feel it. Or they might feel it and think, oh, I probably didn't really hurt myself. I'm all right. And it's not till later when they really see it.
Look, I have a follow-up question.
Oh yeah, I was gonna say. So is it too late at that point? Like if they already start not feeling sensation, like is it like, oh, we're gonna lose the toe?
No, not at all.
Okay, so it's still okay.
That's when the education comes in.
Okay,
and that's when stressing the importance of more regular foot exams. And those are the patients I really want to see every 3 months or even sometimes every 6 weeks. There's some I see every 6 to 8 weeks as well.
So even a shameless plug on this. So you had mentioned a key sign for diabetics is the loss in sensation in the tips of the toes. So let's say if you didn't know you were diabetic, let's say people are just listening to us right now and they're like, oh wait, I kind of notice when I'm walking or if I touch the tips of my toes or on the balls of my feet, I'm not having any sensation. Could that be a sign I need to go get checked for diabetes?
It could be. Okay. It could be. And diabetes is one of those syndromes that affects people in many different ways. And sometimes that can be a sign, an early sign. But that deals with neuropathy, which is like a nerve problem. And people can have those just when getting a little bit older, or if they've had some type of problem with their lower back and the nerves from the lower back innervate the feet. So there's a lot of different things that could lead to that loss of sensation in their toes.
Yeah. You know me, Sean always taking notes. But that's the thing.
I was curious.
Yeah, that's a good question. So are there any like you know, you talked about people just kind of looking on like the cute shoes and things like that. Are there any like shoes that you just would not recommend for like walking or anything like that?
So pretty much every activity, you need a different pair of shoes. So when we go out and maybe we're going, you know, out to something really fancy and you have to get dressed a certain way, especially ladies, we like to wear our heels.
Right.
You know, you have to make sure the shoe fits properly for your foot.
Right.
If your shoe isn't fitting properly, like it's not long enough or wide enough, then you will definitely have some pain, more than likely.
So is it bad for like, let's say for a guy's standpoint, because sometimes like for me, I like to go up a size in the foot because it just feels comfortable. Would that be okay? Or
it depends, because you might need a different width. So it's good to have your feet measured on a regular basis as well. And some of the higher end stores, and not even higher end, it just depends. There's different stores in town. They have a device that you can like.
I know my mom had told me about that before, because I forgot the brand she uses. Is really fancy. And I can't remember the name of it, but some fancy thing, they had to measure her foot. And I was like, what?
But it's funny that you go up a size, because a lot of men typically try to go down because they don't want to look like boat feet. They be like, oh yeah, they be like, well, my feet look big, and the shoe, you know, like the church shoes. They'll go like down a size.
You I didn't know that. No, I never heard they go down.
I'm fine with boat feet. That's fine with me.
Well, I know for like my nephew, he's 15 and he's already like in a size 12, but he's been in a 12.
Kid's grown up quick.
Yeah, wow. He's had like larger feet since like early on, and so he would always be like, I'm an 11. I can fit in an 11, because he didn't want to have like big shoes. But like that could do damage, right?
It could and even do a lot of damage.
I like to, because I still think I can wear kid size shoes. Cause
wow!
Don't do that. I can. They you know, kid size are the same. Don't do that, Sean.
But there are some adults that can wear the kid size,
yes.
So you know.
So I'm like at the last kid size available, but I still get my foot in there. So that's not good. Like that can, I guess, do more damage in the long run. Trying to stuff your foot in a smaller shoe.
Definitely. But I do have some patients. They're adults and they can wear a kid size. That's just that their feet are smaller.
Right.
Really, it just, you get your foot measured and then you go from there.
She's looking at me, for y'all that are not watching, that I'm in denial. I can put a kid's shoe on. I promise y'all. I don't have feet pain yet.
You have those options, because the styles on the kids might be, you know, they're different than the
They're just a little bit more affordable too. Fun fact. Kid shoes are more affordable.
See, I'm not going to play with you.
I thought you would relate, Sean. Most guys don't like their feet.
I have both feet. It's a 12 or no-go. That's it. It's a 12.
And that's okay. It's okay. Dang. You can have larger size. It doesn't matter.
I'm going to ask you. I've been waiting on these. Here. Oh, yeah. Because I did say at the beginning, the good, the bad, and the ugly.
Okay.
Let's get into the ugly. So as a podiatrist, have you had any bad foot experiences or something that just made you be like, oh, wow, okay.
I might call in tomorrow.
I might have to skip lunch.
Yes.
So
all the time.
Really? I can imagine, because I'm like, sometimes we even have patients come in and be like, look, I need Dr. McKinney to help me out. My toenails look like shotgun shells. And I've literally had a patient tell me every time he checks in. So it's like,
shotgun shell. So do you hold your face well? Because my emotions,
you have to have a good poker face. You have to have a good poker face.
Because I'd be like, oh no. Not even like offensively, but just like a natural reaction.
I'm a professional.
Okay.
So, okay, we'll leave it at that.
Professionally, I'm ultimately, there are things that, it makes me clutch my pearls. But I'm more so like,
I want to help.
Yeah, because the patient comes in and often they're embarrassed. Mm-hmm. So I try to ease them through that embarrassment. And then at the end, I may say, I'm just really glad you came today. Because if you didn't, then I would have been maybe sending you to the emergency room and you might need an amputation. And so,
don't be ashamed. Even though you may think you have
never
bad
be
feet,
ashamed.
don't be ashamed.
Because we're here to help.
Right.
And podiatrists, especially podiatry, I'll speak from my own profession, we're here to help. And we want to save feet, because saving feet saves lives.
Yeah, that's true. We need our feet.
Save our piggies.
That's right. Save your piggies.
So, I was gonna ask, are there like any difference between like buns, corns, and like the calluses? Like, or is that like all in the same family kind of thing? Just dry skin?
No.
Okay.
You just named about 5, 6 diagnoses.
6 different things.
Which one are we talking about?
Wait, because like buns and corns the same thing?
Bunions.
Bunions and corns? They're 2 different.
No.
Okay, start there.
Okay, so bunions are normally like on the big toe joint.
Okay.
And
that's from wearing too small of a shoe.
It can be, or sometimes it's heredity. But you can also have a bunion on the little toe, the 5th toe too, and that's a little more rare, but it happens. It just depends on the way the patient's foot is shaped. Corns are it's usually because of a hammer toe deformity. So the toes may be like curved.
She's crunching
a little
her
bit.
fingers, people that are
not
watching.
Right. And corns are normally on top, and the calluses, we call those calluses, are on the bottom. And they all have clinical terms that I'm just not using today, but they're all different.
And you treat that here too? You treat that?
Yes.
Yeah, okay.
So we treat them more conservatively. There are times when some patients just want, accommodation. They just want, what else can I do? I don't want surgery. Mm-hmm. Then there are some that want surgery, and then I'm able to help them to develop a plan to head towards surgery.
Okay.
So you actually may need surgery for like a
callus
and a... Oh.
Yes.
Okay.
Because the corns are painful, right? Or are they both painful? Corns and bunions?
They're all very painful.
Oh.
But everyone is different, because some people have really severe bunion deformity or calluses or corns, and they don't bother the patient at all, or they're not to the point that they need surgery. And then sometimes they are. It just depends. Everyone is a little bit different, so we just take it on a case-by-case basis.
And that's, again, up the point of if you happen to look down and you look at your feet and you may have like a deformity, it's maybe, let me go try to seek out a podiatrist.
Right. Definitely.
Or the doctor, or most people, or not want to say most, but some people will say, let me go see the doctor, and then the doctor will recommend them to see a podiatrist.
Mm-hmm. Right. Exactly. And then we can assess and go from there.
Oh. Now, when it comes to deformities and issues with our feet, I know a common issue I've seen among several friends of mine is like discolored toenails.
Mm-hmm. Especially in men.
How does that occur? Or is there like a root cause of it, or is it like multiple things, or just improper foot care, or
multiple things? You can get discoloration in the toenail from anything from dropping something on your toe. It makes the nail grow back a little darker, or it's like micro trauma when your foot is in some shoes
that are too small.
It could be the too small shoe.
You want a baby feet?
There we go.
It could be
it's full circle moment.
But the toenail just bumps against the side of the shoe, and sometimes that the shoe is fitting properly and it still happens. It just depends. So it could be fungus. Sometimes there's fungus, there's yeast or mold in the toenail, and that can actually make the toes or toenails change colors.
Is that any kind of association like an athlete's foot?
Yes.
Okay.
Yeah, that can even go. That goes along with the athlete's foot. Yes.
What is athlete's foot? Like when your skin is like flaky, or what?
Sometimes it is flaky, but they're usually like little scaly vesicles. That's how we describe it clinically. And it's like little round areas
on the bottom of your feet.
On the bottom of the feet, the sides, in between. It could be anywhere in
and
between
that's when
toes.
I have to get this. You can try to get the spray and see if that works. The what's it called?
Athlete feet.
No, is it Lotrimin?
Something like that. You can try,
yeah.
but the best thing is to do is come see your podiatrist so we can help you out.
That's a little plug there.
That was a plug.
So does it? Okay, now I'm like curious. Like
Yeah.
so, but it's athlete's feet. It's not contagious.
Oh yes, it is.
Oh, it is
It is?
contagious.
Yes, it is. Yes, it is
So
contagious.
for those cuddlers out there,
I'm a
Yeah.
cuddler.
Yeah.
so examine your partner's feet.
Yeah.
It's a fungus, right?
Yeah. Troy's asking athlete's feet. It
is a fungus. Yes.
So it grows more in, moist, warm areas, right?
Yes.
So like if you're not
Warm and
washing your
dark.
feet enough, or you're wearing wet tennis shoes or something.
Yes.
And it's
You can
like
have
little
fungus.
Or even like if you're athletic and you're like exercising and your feet may sweat and you have on some thick socks and all that moisture build.
Yes.
So is it only the look, or like it is another like symptom with it, like itch or something?
It can itch, yes.
Or it doesn't necessarily itch though.
No, it just depends. Everyone's
It can
a little
also
different.
smell really bad.
It can smell, yes.
Oh.
It can itch, smell, be flaky, dry.
So
So
wait
a
a
little bit of everything.
I'm like,
How does
my
smell-
feet don't look like that, but I just need to make sure because I'm a cuddler. I may have rubbed up
You'll
on
go home
something.
and be like, babe, can I see your,
Yeah, let me see your big toe.
run me them toes real quick.
Yeah, let me see it from the side. Let me measure it. Yeah, Cause
So when y'all saw, wait, Troy had brought up a good, y'all are so silly. So wait, when we talk about smells,
Yes.
Mm-hmm.
what do you know, what causes that?
the sweat, right?
Is it the sweat? Like what causes people?
It's really what's in the sweat.
Oh.
From
So
your
it's
diet.
the organisms. No, they're organisms. So fungus, yeast, and mold, they're naturally occurring organisms in our environment. And they get into those areas when it's moist or, warm, dark. And they grow and they live. And they're happy in those areas. Because we have to wear shoes and socks most of the time.
Y'all should see me and Sean face. We over here like on the edge of our chairs. Okay, next descriptive word.
So like even like, cause you know how even like young kids and baby, they all parents will make fun and say smelly feet and all that.
Yeah.
That's because of the bacteria and the yeast and possibly not washing the foot correctly or thoroughly enough.
It could be. Some of it, like all smells of feet, is not fungal related. But then there are times that there are. Sometimes
under
it's
that
just
nail.
hygiene. Because if you don't wash a body part, then it will begin to smell. And then next thing you know, you could develop the fungus.
We're all just like on the edge of our seat.
Can't help but remember when I was a kid and we were riding in the car and my brother would take his shoes off in the back seat. He was forbidden to take his shoes off. But he would try to sneak it in.
He sounds like a menace.
Because we're on a road trip or something,
Yeah.
and all of a sudden this smell would infiltrate the whole car and it kind of smelled like nasty nacho cheese,
Yeah.
Cheese feet. That's the term.
Cheese
It was
feet.
cheese feet.
So what do you think about just random like bare feet? Are we supposed to be barefooted or like we're
No.
supposed to have shoes? Because you know how like
'Cause you can
sometimes
step on.
see
You can walk
kids-
around and step on anything.
Well, I mean, like even in your house, some people will be like wear I like wear slippers
Oh,
in the
now
house.
in the house, I'm
like
barefoot in the house.
Are you bare?
100% of the
You
time.
wear slippers? Yeah.
Slippers most of the time, yeah.
Even with the carpet?
You got to protect your feet all the time. So if you're
John
walking
face
around, if you're walking around on any kind of foot surface, because when we're at home, we think, oh, I don't need to wear anything on my feet. I'm at home, it doesn't matter. That's not true. Because often we're at home, we're working at home. We're cleaning and cooking and doing different things.
Yeah.
And that wear and tear, back and forth, moving around on your feet, it just wears them down. Then the skin gets hard, and you get calluses and things like that. Flaky skin, dry skin.
Cheese feet.
Possibly cheese feet. I've never heard that term, but okay, cheese feet.
Because I see like little kids running around barefooted, or like even when we grew up, a lot of kids would run outside barefooted. I mean, my parents never allowed that, but
I don't know why it's so funny.
but because I mean, sometimes I make my child wear shoes because like they could step on something
Like glasses up.
Yeah, and she's very like a modest little girl, so she needs like boots. She gotta have some. She don't want nothing showing. She's funny, but yeah. So I didn't know that. Like I wear them in the house.
I can't.
Well, I have like a house
barefoot,
shoe.
huh?
Like you gotta have you gotta leave the shoe that you wore at the door because then you're gonna collect all the dirt, and then you have your slipper.
Oh. Whoops.
My kid size slipper.
Sorry, Dr. McKinney. She looked at me like, boy,
Okay.
it's time to schedule.
You're gonna say something, Troy?
Well, I have a random question. What about when the toenails like cracked? We were talking about discolored toenails. What does it mean when there's like cracks in them?
That could again be from trauma, but it could also be from
Calcium?
other types of
think-
things. Other types of diseases and things that can affect the nails as well. So yeah.
And what about if, we just grilling you at this point.
I know, because I'm going like, and then what's next?
What's
And
next? So,
What if my pinky toe turned left? No, I'm just kidding.
what,
What does that mean?
I know this would possibly have a slight thing to do with it, but what about for people that are dealing with obesity? Is an excessive weight, and I know that extra pressure added to your foot can cause some pain, but can being overweight cause other impacts to your feet aside from just the obvious, I have pain when I walk?
It could. And again, everyone is a little different because you may have some really obese people and they don't have any foot pain. So, if they're wearing more proper shoes for their size and everything, then they may not have any pain. Or if they don't have any bone problems in their feet, they may be okay. But, I have seen where patients will have like heel spurs or heel pain, and they've gained weight in the last 6 months or so. And the older you get, your body starts to say, oh, wait a minute, you gained 5 pounds. Wait, now I'm going to start hurting. And it's that excessive pressure and pain.
You brought up a good one. Uh-oh. This is my favorite thing.
Okay.
I know you say this a lot. So they have people that have the heel pains, and you have the heel spurs. But then what's the other term? Because it's not technically a heel spur. It's the
plantar fasciitis.
That.
Oh, okay. Yes.
So for people,
spell it, Sean. No, it's good.
This is not a spelling bee, so do not. So what would be the difference? Because I know a heel spur is basically like would that be considered like a lump kind of on the back, and then you have the
You know what she
plantar fasciitis.
That. What would be a difference in that?
Or is that just the medical term for it?
No, so plantar fasciitis is more dealing with the soft tissues on the bottom of the feet. And then the heel spur, that's more or less inside of the foot, the heel bone or the calcaneus, and it has a little extra piece of bone. That's a spur. So it's an x-ray that tells us what is really going on inside of the foot. There are some other tests that you can use called ultrasound, and you can actually see the fascia, which is the part of the foot that has the inflammation in it. And that fascia is what has a certain appearance on the ultrasound. And then you can see that it's inflamed. That would be plantar fasciitis.
Okay.
But, yeah.
So do you recommend people doing like the Dr. Scholl's in their shoes?
It really depends.
Okay.
I think everyone, if they start to have foot problems, they should just come in and see me or go to their favorite podiatrist.
Yeah. My ankle
Dr.
pops a
McKinney.
lot, so I think I'm a come because my ankles pop. Is that normal? Do your ankles pop?
I have enough foot problems, so I'm not even gonna go
You're
into
not gonna add
like.
that to your list. That's
No.
fair. That's very fair. Troy's shaking his head. Is that normal? Your ankles pop?
No, I mean
No?
the popping is not normal,
Oh,
but it's
my.
something that can
Tell me
happen.
how long I have, Dr. McKinney.
No, it's not that. It's just something that can happen. It's just depends on the joints and how they're functioning in your foot and ankle
I'm
area.
gonna make my appointment because my knees be hurting, but maybe it has to do with my ankles. You gotta check everything.
It may.
Rachel.
I am concerned, Sean. So I know this one question is for me. What do you think about pedicures? We're talking about the nails.
We
and
talk
all of
about
that.
feet. Look, and I told Rachel before. I was like, this is Dr. McKinney's favorite thing. Pedicures.
Because you would think like that's feet maintenance, right? They're cutting your toenails,
They cutting your cuticles. They scrubbing the calluses off, so our feet are all soft and
my
pretty
lady's
at
so
the
nice.
end.
She's always like, "Don't use this one, use this one." And they put the little hot stones on my legs and
If y'all could see her face right
yeah.
now,
Please stop and get
she
on
looks
YouTube.
over it. She's like, "Okay, guys, I'm done here."
So pedicures are probably okay as long as the patient is young and healthy again. But as patients develop more comorbidities, it's not really a good idea unless they're going to like a medical spa, just someone who is either overseeing or doing the foot care themselves, who is licensed, a doctor even, someone who could really take care of those special patient concerns.
Okay. Do you treat hangnails and all that, or do you?
Ingrown toenails.
Ingrown.
Now I know
toenails,
I've had a pedicure and I've caught an ingrown. I think Dr. McKinney actually helped me with it. I had a pedicure, got an ingrown toenail, and it actually got infected.
Oh, yeah, they.
That is the most.
I get ingrown toenails.
That is the most.
No,
But not like that, but
it's very common.
Oh,
And-
is it because my shoes too small?
It might be, yes,
Oh, my
ma'am.
goodness.
Yes,
But I know that
ma'am.
You're getting those pedicures.
I love a pedicure.
But I remember
time.
Dr. McKinney was talking about the ped because I was like, the last time I really had somebody mess with my feet, and then right after ingrown toenail, and then it got infected, so my big toe had turned in like huge, and it was purple, and I remember it was the most excruciating pain
Yeah, they're not fun.
You have to be very careful.
They're not fun. I'm gonna let you look at my feet one day, and then you can tell me if I can keep getting my pedicures. I love my pedicure lady. She's so nice. They got a family to feed, Dr. McKinney.
I know, but it's you just have to
If y'all could just
be
see,
very
she's really
selective.
cringing right now. She is cringing.
Be very selective on where you go.
Yeah.
Make sure that the place is extremely, clean, and they have good sanitation processes and things like that.
When I was younger, like it was like one spot. I look at it now, I'm like, you actually went to get your feet done here.
Yeah.
Those were like times when times was hard.
Yeah.
Like I'm funny now, so now if the tools don't come out of like the sterilization packs, it's like, where did you get that? Can you open the pack in front of me?
I trusting that. I feel like they got the little sticky glue at the top, and they just make everybody. You don't feel like that sometimes?
I know.
Dr. McKinney hates pedicures, basically.
No.
So do you do your own pedicures then? Like you kind of do your own.
I do everything for myself. Yeah.
You do your own.
I don't. Yeah.
Is nail polish bad for your toes?
No.
Okay.
But it has chemicals in it that can cause
discoloration
to the toenail. And then when you go to some of the places, they ask you to pick a certain color, and then it's very possible that whoever was before you and they used whatever. I don't know how they go about separating.
I've never thought of that.
Yeah, I mean, either.
So it's just something to also, if they allow you to bring in or buy new polish, that might be an option for you. So it's just something to think about.
Wait, time out.
I guess I'm never going back.
That's something I've really never. It's one of because like
she's over here.
I'll give you an example. So a good example, I'll say like when it comes to like germs and stuff, that people use the airport, and when your bag goes into claim, and you don't know how many hands are touching it, what it's touching when it's going through the little machine and all that germs. So now that you're talking about nail polish, and I'm picturing it in my head because it's one of them little things you just don't think about. The people pick the color and they use the little brush that you know what the girls do, and they pick the brush and then they paint the toenail and then they put it back on the countertop.
Because some toes may need to see a podiatrist, and then some toes.
So their germs from that brush get into your toes and
then they come
That's why your eye twitching.
That's why my eye twitching.
So it's like hundreds of different sets of toe germs are in that jar before they paint it on your toe.
Yeah, I've really never thought about. That's one of those aha moments because I've never thought about
to think about.
Yeah.
Oh my god.
Because my place, they do the little baggies now, so you're not dipping your feet right into the water. Like
that's good.
They wrap the
that's a common practice I started to see.
Yeah.
But the toenail color.
You're gonna start bringing your own polish.
Well, I mean, I use like the clear, but it's.
But I know.
I've never really. I'm really baffled.
I know, honestly, and I don't know what they do really. So you may have to ask the next time you go, because I don't know what the common practice in that industry is for that.
But I know.
But from a medical standpoint, from a professional standpoint,
from what I have seen,
it's a no for you.
It's what color? Pick your color. Mm-hmm. They want you to pick your color,
and then sometimes it's already sitting out. Somebody just used it.
Somebody could have just used it.
Wow.
But I noticed too, because I only get white toes. I'm one of those. I know. But like it does, like the more that you get a certain color, like it's harder to come off your toenail.
It is.
Yeah, like some polish just wants to stay forever, or like you can't get red because it stains.
Yeah,
I'm still stuck on the whole switching of the. Like I'm really like shook right now.
Yeah, they don't switch that out.
That one got me.
Yeah. I think I'll be a little bit more
investigate that.
A little bit more selective.
The more you know.
If it's some kind of enamel polish, maybe the chemical in the enamel kills germs.
Look
She's
at
saying from
Dr.
her experience.
She's like, it's a hard no.
People getting their toes painted and immediately coming to see her.
Just be very careful. That's all I say.
The more you know.
The more you know. Who would have thought?
Hashtag.
All those toes.
All those toes.
You gotta plug it in. All those toes.
Boycott pedicure.
No, that's not what you saying.
I'm not saying that.
Just kidding.
Don't give me a
So I think I'm gonna still get my pedicures, but be more selective.
Yeah, just be more mindful.
Yeah, like bring my own polish. Cause
definitely.
I mean, I only get one color, so I can go, and I actually have it at home. That's weird that I don't bring it with me. You know what? Okay.
That's what I'm saying. It's one of them. That's actually like honestly, that's something that you never really just think about until it's brought to the forefront.
Yeah.
So it's okay.
Yeah. So my last question, what I have to ask, is there any questions that you would recommend a patient like asking their podiatrist, like anything in particular? Because sometimes they'll come in, they may be a little not knowing, like Sean said, what to expect and things of that nature.
Yes.
The forbidden phrase. I am so sorry.
For those that don't know or have not watched before,
I'm not supposed to say things of that nature.
When I tell you Troy used to get on me about things of that nature, and now Rachel finally said it.
I'm so sorry. But I do want to know, like, are there certain questions that we should be asking the podiatrist? Like, my ankle popping, is that normal? Like, what should we ask?
Yeah, really anything that comes to mind regarding your feet, Yeah. And often it's once they get into an appointment, they start talking, and next thing you know, they think of different things to ask, and then we're able to go on from there. And then if they have more questions, I always just say, come back and see me, or, call me, and we'll answer your questions, right? So it's not really anything hard and fast. I do a lot of education. So if they smoke, I talk about that. If they have diabetes, we talk about that. So just really depends.
Yeah, I like that. Seeing hope.
So question: when you had said earlier about measuring feet for shoes, I'm trying to see how I want to word it. When we go to buy shoes, like let's say it's the first day of school, we're school shopping. You go to the store, you see all these different brands of shoes, but they don't really tell you about. They give you the size, but they don't give you the widths. Is there a particular type of shoe parents or even just regular buyers should look out for?
That you wouldn't recommend.
That you would recommend us? Because I know, like my mom, she's weird. Like she only wears Asics,
right? Because
I guess the way it's done, you can get an Asic shoe based upon all the measurements, like a custom. But what should parents look out for when they go like school shopping?
Just really making sure that it's a good pair of shoes. I'm not saying that they have to necessarily go by name brand, but if there are foot problems, possibly going to see a podiatrist first, taking those shoes with them to the visit and saying, this is what I bought in the past. Is this the right shoe for my child? And really, it goes more, again, on a case-by-case basis.
Because there's, like, walking shoes. So
exactly. They may play sports. So, yeah.
Like, these might be the right kind of cleats, like...
Correct.
Oh.
I know I said that was my last question, but I have one more. What leads to, like, flat feet?
Flat feet?
Yeah, everybody naturally has an arch, right? Or
not really. It depends. Again, it's genetics. A lot of it's genetics. So
you can be born without an arch?
You can.
I didn't know that.
Yeah. Yeah. The feet.
Do you have an arch?
The feet evolve.
I've honestly never thought about it.
The feet. That's a good question. The feet evolve over time, and sometimes it's just genetics. Some people have a flat foot. Some people have a really high arch foot.
Because they say the arch is better, right? They if you have a high arch, like God's favorite.
No.
Girl, what?
You never heard that?
I never heard that.
Okay, all right.
You hear about some interesting things.
I'm on it. Like, obviously, y'all are not on. So, because like when women wear high heels, like it's better to have a high arch. They
really?
say.
I don't know. Because flat feet can have problems and high arch feet can have problems.
Or is it the opposite way?
But it's not necessarily bad if you're flat-footed, is it?
It's not. No, it's not necessarily bad.
Oh.
You just have to wear the right shoes that support your feet. And the same thing with a high arch foot. You just got to wear the right shoes.
Maybe I got it mixed up because the way y'all looked at me.
Maybe
you're not supposed to have a high arch.
So
a medium arch.
So since we're talking about the high arches and the shoes and stuff, is there a reason why? I'll just say for ladies, why did people pick the different size in the heel? Does that correlate, or am I reaching?
I don't know, because I need a black heel. I can't even do it.
Like I know sometimes like some ladies prefer to wear, like, I call it the kitten heel.
Oh, I'm a kitten heel girl.
Don't tell nobody that.
You can see it. We ain't nothing to tell.
But some people prefer the smaller heel compared to the bigger heel. Does that correlate with like proper foot?
Maybe it's just how they, what they're wearing or their preference, like what they feel more comfortable in. Because
it was this TikTok trend.
It just depends.
I don't know the name of it, but it's like a numbing. Like if you have like muscle pain, it was like one of those creams, and people were putting them on their feet to wear their heels.
Really?
Okay.
I never heard that. Right. That's interesting. I don't hear it a lot, but that's very interesting that they would do that.
Yeah, like you know how like a icy hot type cream where it numbs you. It's not icy hot per se,
but it's just a numbing.
Yeah, because it worked. I did it one time.
Really?
I had to go to New Orleans, and they did like the second line thing, and we had to do like walk around. I was fine.
Oh, okay.
It's
'Cause
when
normally-
we stopped
'cause
walking though, I had to go change my shoes.
Because normally your foot would have hurt if you
More.
wouldn't have used the numbing agent.
The numbing.
Yeah, I don't recommend that.
Yeah, I'll
You
let
see her face again. She's like, girl.
Okay. And I'll be watching them videos.
I'll see.
Yeah.
Watch the videos.
Well, I mean, just looking at some of your reactions, I think I would just keep to the videos. I used to think that I would be a great podiatrist. I just like people's feet.
Okay.
I love doing painting toes. I think it's just so cute too.
All those
That's so
toes.
nice.
No, but like now we're talking about. I don't think about smell, but I can't do smells, so I think I'll just
Well, she
stick
said
to my
it
videos.
has to. It also it goes with like hygiene and stuff.
I'm gonna
so.
stick to my videos. So I just
Oh, okay.
watch from a distance.
Just let them come see me. I'll take care of their feet.
Perfect.
Doesn't matter.
Book an appointment.
That's right.
Okay.
So,
Do you have anything that you want to add on about foot care that we may have not touched?
Mainly if there is a problem, come see a podiatrist. Come see myself or go to a podiatrist. So pain is not normal. So people say, oh, my feet hurt, but yeah, they're supposed to hurt, right? No, they're not. So if your feet are hurting, if there's any numbness or tingling, something strange going on, any pus or blood coming out of the foot, that's something that needs to be taken care of.
And
any
even if-
rashes or anything.
and even if they don't see you first, make sure you let your primary care doctor know, and then that way they can recommend you to see the podiatrist that we have.
Definitely.
So
Yes,
your foot
definitely.
falling asleep is not normal?
No, it's not normal, but it's common because of just the way the body is situated. And if you're sitting in a certain place for a long time, then your feet can become numb.
Yeah.
But that's not normal.
It's funny. My little niece, because she sits on the toilet, she like stays there, and like she'll scream like her feet are gone, because the
feeling.
circulation.
Yeah.
Okay.
That can
like-
actually, doing that a long time, that can actually cause some problems later on. So, yeah,
Oh, yeah.
we don't want to encourage that.
Yeah. Okay. I learned a lot. I'm really so happy that you were able to take time out of your
Yes.
busy schedule
I'm still stuck at the toenail polish.
and educate us.
I'm like done here.
Sean is like, never again. I'm gonna start bringing my own nail polish. This was really, really insightful. So we appreciate you coming out.
Thank
and
you for having me. I
No
appreciate
problem.
the
And then
opportunity.
and then Dr. McKinney can be found at Conroe, Greens Point, Bel Air, and Sugar Land.
That's right. That's right.
Yeah.
4 locations.
Any coming soons?
Hopefully Northwest.
Okay.
That's what I'm aiming for.
All right.
You live
So
in there? That's more. No.
No, I'm everywhere. So
Okay, it doesn't- at
Really,
this point-
it really doesn't matter.
Yeah, you'll be there. Okay.
wherever there's foot pain, she will come.
Yes.
You're right.
But one other thing, can I say one more?
Yeah.
So if if anyone who has diabetes or they know someone who has it, if they can just recommend that their family member or friend see a podiatrist at least once a year. I keep seeing patients over and over who have not seen a podiatrist ever, and they've had diabetes for over 20 years.
Oh, wow.
And it's like there's a lot of things that we can prevent. So that's just my little plug.
Even pre-diabetic?
Pre-diabetic, that's fine too. That's a good opportunity for us to educate. I'm able to educate patients on, just what to look
Things
out
to
for.
avoid.
So I just wanted to say that too.
Okay. Thank you so much, Dr.
Thank you for
McKinney.
having me. I appreciate it. Thank you.
And then if you guys want to schedule with any of our providers, or more specifically our podiatrist here, Dr. McKinney, you can visit our website at offeringhope.org, or you can give us a call to schedule at 713-778-1300. And here at St. Hope Healthcare, you're more than just a number.